All right, so we are starting with this one. The first part is known as marking. Marking is done. Second is launching. DADR. Where is D? D. And second is A. That is D. And the last is R. R, you know what is R? R means RE. That is a referral. You have to write the patient's name here. What is the patient's name? Lena Snell is a patient's name. Take it and just write it here. Lena Snell is here. Then give a semicolon. Okay, semicolon. Then write the patient's age, 11 days old, only 11 days. Just write just as it is, 11 days. So we wrote this part. Now we need the date. Today's date. Where is today's date? Can you find today's date somewhere? Admission details are given here. And 1st April, 2nd April. So if you do not find today's date at the starting of the letter, if you don't find any starting of the letter, you have to find out the today's date at the end of the letter. There are 31st March and then 1st April and 2nd April. Today's date is, okay, so you are writing this letter today or tomorrow or yesterday, you have to check it. Read this part. Plan for discharge today. The discharge is also today. Monitoring of blood sugar is required for next 7 days. Mother needs education and guidance about newborn care. Plan. All these things are mentioned here. So the discharge is very clearly today. So you are writing this letter today and the discharge is also today. So you have to write the date here. The date will be 2nd April 2024. So we got the date here. So we are dealing with the first part of the letter that is known as the DADR, or the launching of the letter is now going on now. Everybody listen to me. Just after 1 week, you will be comfortable with writing your letters in this way. Okay. So launching part is done. And in this one, date and address. We have to take the address very much from here in this area, the writing task area, you will be able to find the address. Let's take this one and take it here, and the address will be completed in this way. Where is address? Using the information given in the case notes. A letter to Senior Manager, Valley Health System, Kent, UK. Kent, UK. Since Kent is in UK and the letter is written in 2 places in the same UK, you don't have to write UK here. Please avoid the country name in all the letters where the address, the sender and the receiver lives in the same country. Do not use that one. Okay. Valley Health System, Kent, that is enough. Okay. So now you can go to the dear something. Okay. What is that? You're writing to dear Senior Manager. Senior Manager. Are we sure that the senior manager is a nurse or doctor? We do not know that. So dear sir, but we are not even sure that the senior manager is a male or female. So we can write dear sir or madam, and then a comma is mandatory. Hope it is so far very clear to you. So we are in the launching area now. As per the launching, we have to write D for date, A for address, and D for dear sir or dear madam, and then RE. This is the second step of writing a letter. This part is the second step. So we have written the second step of a letter now. Now it is the third step is known as opening of the letter. Opening of the letter. Opening. In the opening of the letter, the code that we are using is PRPDD or PRPTT. Now somebody can tell me which one is best here, PRPDD or PRPTT? DD or TT? D for discharge, D for discharge, yeah, T for transfer. We are discharging the patient. So definitely it is not a transfer, it is a discharge. So we are going to copy this one and we are going to start the next level or the opening level with the PRP DD. So got it. So D, the last D. Okay, so what's the patient's name? Patient's name is Lina Snell. 11 days. That's a baby. So write baby here. Don't forget that. B capital here. So baby Lina Snell. Just write it here. So P, in the place of P, write the patient's name. Baby Lina Snell. What is R then? Requires. Requires what? What is the purpose? So the purpose of this letter is advice. Do you think an 11-day-old baby needs advice? No. Basically, the main purpose of this letter is using the information given in the case notes. Write a letter to Senior Manager, Valley Health Systems, outlining the needs and the problems of Lina and her mother. Both of them are here. Mother is also there. Lina, the patient, is also there. And in the plan area, mother needs education and guidance about newborn care. Basically, this is the most important part here. Can you find out home phototherapy for next 7 days, medication monitoring, monitoring of mother's mental status, maternal and child home care program for breastfeeding education, lactation consultation, plus daily assessment and monitoring of the child. All these things are combined together in this one. So can anybody tell me what is the real purpose of this one? What is the real purpose of this one? I think this line can be the best line for, because it includes everything. And home phototherapy need to continue for 7 more days. That can be for yeah, there are so many things in the plan area here. Purpose, monitoring of mother's mental status. So many things are here. So are you going to write all of them here? In such a case, you have to write the purpose will be something like requires purpose will be continued care for the baby and child care advice for the mother. See, it's not complete. Okay, this is not complete. I'm coming to, okay, now look at this one. When there is a mother and a baby combination, remember, we have to write differently. When there is a mother and a baby combination. Let's do, I asked you one question earlier, PRPDD or PRPTT, then somebody told it is PRPDD. You're right, completely right. But this is a mother-baby combination, so we have got PPRPDD. PP. So that means one P will be included. So this is these two P, one is patient, one is parent. PP, patient and parent. So whenever you see it is a mother-baby combination and the mother needs advice, in all such cases, you can write what is the name of the mother. You have to find out the mother's name. Mrs. Darlene Snell. Let's take this one now. Mrs. Darlene. If we are starting this way, always remember this method is the best one for mother-baby combination. So Mrs. Darlene Snell, comma, mother of baby Lina Snell requires continued care, sorry, then continued care advice. Basically, there's a problem. Care for the baby and child care advice for, because OET has very clearly said that we do not have 2 patients at all. They will not give us 2 patients. Now we have to make some modification for that. Can somebody suggest any modification for that? Mother of baby requires continued care. No. Who needs more support? Please tell me somebody. Who is needing more support here? Mother needs education is a very important one. And then plan is here. Mother needs education and the baby needs further care. And okay, now I think we can write this way. Mrs. Darlene Snell, mother of baby Lina Snell, requires advice on baby care, advice on the care of the baby who will also require, oh, that's a bit complicated one. First time we are writing this kind of a letter. Care for, okay, care, yeah. Okay, let's try to write this way. Mrs. Darlene Snell, look at this. Mother of baby Lina Snell, comma, requires advice on the care of the baby who will also require continued care at home Okay, this way we can almost, okay, now what is the condition of the patient at this time? What is the condition of the patient at this time? Because the D1 is always the discharge condition. What is the condition? Can somebody tell me what is the condition of this patient? How do you know the condition of the patient? The baby's clinical parameters are satisfactory. Plan for discharge today. Now, is the patient recuperating from some kind of problems? She had convulsions. Phototherapy to be continued. Okay, what was the problem with this one? Mrs. Darlene reported anxiety regarding newborn care. Okay, now look at this one. Jaundice was there, mild respiratory distress was there, repeated convulsions. Can somebody tell me what was the baby's problem in one word? Do you simply want to say postnatal complications or do you want to say something specifically? Anybody?
Jaundice.
Just jaundice, mild. Okay, jaundice was there. Mild respiratory distress also was there. Convulsions also were there. See, three things are mentioned here. So just jaundice will be incomplete. So we can simply say like postnatal complications including jaundice would be fine. Yes, including jaundice and mild respiratory distress can be included this way. One second, let me come to this one. Yeah, we are completing this one. The baby is recuperating from postnatal complications including, yes, including what? Jaundice, including including jaundice.
Sir,
Yeah.
the conversion is most important rather than jaundice. So we
Oh,
have to
you're right, you're
mention.
right. Yeah, the convulsions is a really important one. Okay, so since there are three things, it's not good to write all of them. Just we can avoid this one. So jaundice and mild respiratory and convulsions can be included in the coming paragraphs, not in this paragraph. That's because OET always says the first paragraph should be very short. We cannot write very long ones. Mrs. Darlene Snell, mother of baby Lina Snell. So suppose we don't need this one, mother of baby Lina requires advice on care of the baby who will also require continued care at home. The baby is recuperating from postnatal complications and is being discharged today. So this is the most important part of every letter. Please remember, this is very important because usually nobody will lose mark for the first part. That is a launching part. This is a launching part. But in the opening part, many people commit mistakes. So here we have decided which method we need. So we use the PPR PPD, model. Mrs. Darlene Snell, mother of baby Lina Snell or Lina, requires advice on the care of the baby who will also require continued care at home. You can write in a different way also. In the place of Darlene Snell, you can start with baby Lina. You can write. But then how will you include the mother also? Because in the discharge plan, mother's condition is also very important here. Maternal and child home care program for breastfeeding education. See, the first thing itself is breastfeeding, education, lactation consultation, all for mother. That's the reason, since it is in the part of the plan, I'm giving more importance to the mother here. So wherever you find advice for the mother, always use this method. What is that? PPRPDD, that method, right? Mrs. Darlene Snell, mother of baby Lina. So P and mother of baby Lina Snell, sorry, mother of, yeah, baby, that is P. This is the patient. This is parent. This is patient. Then R for requires. And then this is P for purpose. Advice on the care of the baby who will also require continued care at home. Then this one is known as PPRP, D and D. The baby is recuperating from postnatal complications. And see, this is the last one. D, discharge date, and is being discharged today. Everything is well placed in this method. Please, everybody, use only the PRPDD or PRPTT or sometimes UPRPTT or TPRPTT or PPRPTT, or even in the place of ET you can write DD. These are the only ways to write your letter opening paragraph. If the opening paragraph is excellent, you will get a good score in letter writing. Okay, that is what I want you to understand about the. So we have done three parts are done. Marking is done, launching is done, and opening is done. The next is known as narration. And after narration, we have got signing, signing of the letter. And everybody knows how to write the signing. How to write the signing? We use S or F method. What is that? Yours sincerely or yours faithfully, right? Since we started this letter with madam, sir, madam, without name, definitely we have to write yours faithfully will be written at the end. Anyway, that is the last thing. Yeah, tell me. Okay, fine. If you have a question, you can ask me anytime. So marking is done, launching is done, opening is also done. We are going well with this letter. All the three parts are done. Now we are moving to narration. And anybody knows what is a code for narration? We have two codes. One is the V method or the W method. So somebody wants to know what is the meaning of W method and V method. Okay, this is very silly, very easy. You will really be able to understand. V is used when it is a home, it's a discharge letter. In discharge letters, discharge letter plus a nurse is involved. Nursing is involved. There we need to write the V form. And if it is a transfer letter, generally we write W method. In the W method, it will be having the past medical history also will be mentioned. That is the reason it is like W. And V is just the recent medical history and present medical history. That is V. I will make it more clear to you because some of you really want to know more about W and V method. I'll just once again tell you what is that. Look at this now. V and W. We have already written the opening paragraph is already written. Now we are going to the second. And first, let me just complete the V method. Then I will go to the W method. As per the V method, this one, the first part is all about the past medical and the recent medical history, which will be in the past tense. Whereas this area will be in the green color will be present tense and future tense will be here in this area, V method. So let me just make it more clear to you. Here, this one, in the second paragraph, you will be starting with what? What line will you usually write? Baby Snell or baby Lina was born 11 days ago, or just the date, and she had this complication, she had that complication. So in the in the second paragraph of the letter, see, we have already completed the opening paragraph is done. In the second paragraph, you have to write only past tense here. So the blue color indicates past tense. You have to write only words like she was admitted, she had this distress, she was diagnosed, she was, or something like that one. This medicine was prescribed. So everything will be was. Completely was. Or you can also write had, that is also past tense. Did is also past tense. Okay. Underwent is also past tense. Underwent is also past. Oh, underwent is also past tense. So the second paragraph or the narration part, the V method, will be having only past tense. Once the past tense is over, you'll be entering the present tense. At present, the baby is stable. See, from here onwards, you'll be writing words like is stable, she can like breathe normally. See, everything is present tense here. In the past tense, we had past words. In the present tense, we are having this one. At present, currently, all these words will come in this area. But you should be very careful about one thing, all of you. You know what that? you should be very careful about one thing. You should be clear about where the past is ending, and where the present is starting. Once you enter the present tense, sorry, you cannot go back to past. This will be like this, and this will be like this. You can write any amount of past tense you can write. Sometimes you need only very little past tense, but it will be having too much of present tense. In some cases, you'll be having very less present tense and future tense, but you'll be having too much of past tense will be here. Nobody can say that how much is required. So complete the past tense and then go to the present tense using now the baby is able to, or currently the baby is able to. So this way you can write. So this is known as the V method, in which you have to write the past tense first and then enter the present tense and go to the future tense. Okay, in the future tense, you can also have, it will be appreciated, it would be appreciated, all the things will be there in that area. I hope it is very clear to all of you. Any question, please?
Sir,
Yeah, Parag.
sir, I mean, in second paragraph, we are mentioning about baby Lina's past condition.
Yeah, past all the means her
So both
birth.
we have to first we have to mention about the past
Yeah.
condition of the baby,
Hmm.
and after that, in the same para, we have to mention the recent or present medical history with
It
whatever
can be.
medication.
Okay, wait. Suppose you have so much of things in the past tense, you can have one paragraph for the admission. Another paragraph can be given for, like, you can have multiple paragraphs in the past. It's not necessary that all the past things should be in just one single paragraph. We divide the paragraph when a paragraph becomes huge, a big one. So you can have two paragraphs, no problem. You can sometimes even have three paragraphs for the past events. And then once you enter the present event, you can have just one paragraph and you can go to the future paragraph and say that it will be appreciated and other things. So the number of paragraphs is not a problem here. It's all about the content that is most important here. In this letter, I can show you something here. In this letter, basically, this whole thing will be past tense. So I'm changing the color into blue color here. And then this one also happened in the past, so all will be in the past tense. So you have to write them in the past tense. Since we are writing this letter on the 2nd of April, everything that happened on this date also will be in the past tense. Past tense will be used here entirely for this one. See, for example, I can show you. Look at this one, all of you. Just a sample here, okay? Yesterday, so we don't have to repeat the date every time. Yesterday, since it is a starting of a new paragraph, the baby, or simply write Lina, okay? Lina had, see past tense, had no convulsions and was, see was, and was clinically stable with normal glucose levels. Change these G and everything small, okay? Level or levels, fine. To be continued, Miss Darlene Snell mother reported anxiety regarding, okay, so to be continued means it was decided to continue phototherapy, yes, okay. However, see, there is a negative thing here because all these things are positive. So we are going to a negative thing. Miss Darlene Snell, since we have already mentioned here, Miss Darlene Snell, I think Mrs. is written somewhere else. Mrs. Darlene Snell or Mrs. Snell is also fine. Reported anxiety regarding newborn care. So this is also completely past tense. Now we are entering the present area now. So today, baby's clinical parameters are okay. So now yesterday is over. Today, we don't have to repeat the date again. The babies, sorry. Now look at this, all of you. I'm entering the present tense now. This is all. Okay, please remember, I don't know, nobody thinks that way, that you have to change the color in the exam also. No, you don't. You have to write with the pencil only. Don't change the color. Maybe, I don't know how many of you will be thinking that way. No, nobody is there who thinks that way. Today, the baby's clinical parameters are satisfactory. Therefore, discharge has been planned for today. Has been planned, because has been is present tense, not past tense. Okay, monitoring of blood sugar required for next. This is a this will not be used here, and guidance about newborn care. This will be coming in the next area. Okay, let's write that one. Monitoring. Actually, this is a plan area, plan thing. This is combined here to confuse you. So all these things will be coming in this area. So we have to write. Now, look at this one. Next paragraph. Or since it is a single paragraph, what you can do is reported anxiety. Today, the baby's clinical parameters are satisfactory. Therefore, discharge has been planned. That is enough. Planned. Okay. Wait a second. We can combine it here. See, Parag, just you asked me a question earlier. We are going to combine this one, but this will remain present tense, but that will remain past tense. This is the end of Pacific Ocean, and this is the starting of the Atlantic Ocean, something like that. What? Once you enter the present tense, remember, you cannot go back to past tense. You have no return to past tense. That is it. So be careful about entering the present tense. So now we are going to the last paragraph, considering the babies and mothers' current condition, comma, kindly, we are starting the last paragraph now. Kindly monitor the babies blood sugar levels, which is required for next 7 days, for the next 7 days. OIT will never write a word that is required for you. Mother needs education. Please note, comma, the mother needs education and guidance about newborn care. This is already repeated. Now you have to write the remaining part of this letter, and the letter will be complete. I hope you have all understood what is the meaning of the V method and the W method. Just for your curiosity, let me tell you what is the other one. That is the W method. Sometimes you will have to use the W method here. W method means this will be, that means second paragraph, third paragraph, maybe fourth paragraph also will be here. Then just before the what do you say, the request paragraph, the second last paragraph will be something like a past medical history will be there. If a past medical history is important, you can mention here. That's the reason it is blue color. So whenever you write the past medical history, her father died of this cancer 2 years ago. Died is a past tense. So it is usually not required in this case. So sometimes the past medical history will be very less. We don't require that. But whenever you write a letter to a doctor, an unknown doctor, we have to mention all the past medical history, especially if the patient's condition is not diagnosed. So that is all enough for today for writing, and we have done a lot of things today. So please, all of you, start writing the letter, and those who have a personal trainer, you have to write the letter and submit it to your trainers. Okay. If you have not got your personal trainers yet, please contact me. I will assign a personal trainer for you. That's the end of this class. Please continue your task, and you'll be getting more tasks. After writing, you have to do the listening. The audio has already been uploaded in the group. Please go for that. All the best. See you.